Welcome to Mighty Married Moms. Join us at our kitchen table twice a week as the Mighty Married Moms, Debbie, Linda, Wendy, invite spectacular guests to weigh in on staying sexy, vibrant, and healthy, building marriages with soul-satisfying connection, raising happy, healthy, successful kids. Conversations with Mighty Married Moms will bring you closer to the life you really want. Episode 29.
Hi, and welcome to Mighty Married Moms. Today we are really excited that we have Dr. Brad Weiss here. He's the Director of Performance Health Center in Natick, Massachusetts, which is a premier multifaceted chiropractic facility. Dr. Weiss has been in practice for over 30 years and is one of the few fully certified active release techniques providers. So he'll talk to us, I'm sure, a little bit more today about what that's about. He provides care to entertainment superstars, to world-class athletes, from nose to toes, as long as there's no blood or guts. They have a place where you can go for all of your healthcare needs. And I just want to say that I am a patient of Dr. Weiss, my entire family, and I really believe in chiropractic care. I didn't get it when I was growing up because I don't think I knew it existed then. It certainly, we won't talk about how old that makes me, however, but I believe it's important for my kids. It's important for me. And I really went to Dr. Weiss with an injury, but learned a lot about long-term wellness, longevity with chiropractic care, that it's not just for when you have an injury, that really it's important to be getting it all along. So I'll let you talk about sort of your path to doing what you do and tell us a little bit more about you.
Okay, thank you very much for having me on your podcast. I've been a chiropractor for 30 years. I started being a chiropractic patient when I was about 8 years old. I didn't have health issues. My mom noticed that one shoulder was higher than the other and one pelvis was higher than the other, so she took me to her chiropractor, did an assessment on me, gave me an adjustment or two, and everything was level. And ever since that time, I've never had any issues.
Wow.
I would go both for maintenance care as well as for injuries. I'm a younger brother. My brother would say occasionally, do you think we could jump off that roof? And of course, as a younger brother, I would jump, hurt myself, get fixed up. I played sports. But chiropractor was always our family physician in many ways growing up. We had our primary care physician. We had our chiropractic physician. He took care of my musculoskeletal health.
Wow.
And that's what I do with my patients. And it's a wonderful thing. We've worked with generations of patients, and our youngest patients can be anywhere to a few days to a few weeks old, and we have patients in their 90s in our office.
A few days?
Wow. Tell us a little bit more about that. How do you do care with little tiny babies? And what does that do for them?
Obviously, very gently.
Yeah.
Dr. Rosenberg, who is head of anthropology at the University of Delaware, was quoted in a National Geographic article as saying that navigating the birth canal is probably the most gymnastic maneuver most of us will make in life.
Makes sense.
Wow.
Makes total sense.
Yeah.
Some of us have an easier time getting born than others. We work with kids, and there's been a lot of research published showing that chiropractic care can help kids with colic and ear infections. And if you want to grow healthy, you need a healthy spine. If you take a twig and you bend it, the twig grows crooked. If it grows straight, it's going to grow straight. And we do a lot of work with parents. We've all had your mothers, obviously, and I'm a father as well. Kids fall asleep in the car seat and their heads bop up and down, and it drives you crazy. Was that affecting their nervous system and their spine? It could. Then they learn how to walk. How many times do they fall on their butts? They're stuck in school sitting on these awful chairs all day long.
Oh, they are.
They're on computers. They're on their smartphones. I mean, all these things affect the spine.
Sure.
Posture is so important. A big part of what we do in our office is help people.
Or sit up straight. All of a sudden, we're sitting up straighter.
Improve the posture. And actually, the first time ever in 2013, an article was published showing that there's a direct correlation between how far you slump and how bad your posture is and the risk of you ending up in an assisted care facility. So
wow.
The direct correlation between how you hold yourself and the risk of needing assisted living as you age. No one wants to grow up and end up in an assisted care system, but you have to work backwards. George Burns, when he turned 90, said, if I knew I was going to live this long, I would have taken better care of myself.
I've heard that.
To do when they turn 90 is say, I knew I was going to live this long, and I took great care of myself, and my chiropractor helped me go on.
Absolutely. Absolutely. Well, I know when I went to Dr. Weiss, I had one of the big things. I was a shoulder issue, and I was having a hard time raising my arm, past here, which I can do now. But one thing that you taught me was it was about my posture. It was worse than an injury. You have bad posture, and it's so true. I've really thought about it a lot since then. I also do yoga, and it's amazing the difference. And kids, you're right. I mean, kids, I see my kids, they're just all like,
oh, I know. My youngest son has got the teenage slump. I keep trying to push his shoulders back. Stand up straight, please.
The problem is he doesn't know what that means, and neither do you. What I do is to show people how posture is important and how to make it a game and make it fun. But when you tell someone to force their shoulders back, that's not good posture. And I don't know if
like this, so anything's better.
if you slouch, okay, and you bring up your arm as high as you can, that's all I can bring my arm. I sit up nice and straight and have lifting from my chest, and I do the same thing. My arm goes all the way.
Yeah.
Is the shoulder problem being caused by, poor posture? I mean, you could have the injections, you could have the surgery, you could do the PT, you could even have chiropractic care, but unless you change the way you hold yourself as part of that rehabilitation process, that injury will perpetuate or maybe come back and manifest itself in a different way. So it's all about function.
Function, yeah.
Yeah.
Is there a relationship between chiropractic and functional medicine? I know that that's a whole realm of medical care that's kind of new to me. Do you know functional medicine?
Yeah. I do.
Is there?
I think that we are functional doctors. I mean, we teach people how to use their bodies. Your body is mechanical, okay? I mean, traditional medical treatment, which is wonderful, they deal with the organs, okay? My job is to take care of the musculoskeletal system, which is the muscles, the joints, the bones, the ligaments, the tendons, and then there are pathways. There are 24 vertebrae in your spine, but there are 135 joints. And those joints move, don't move in one direction like your fingers move, but they move in 6 so we can be human and enjoy life. My job as a chiropractor is to make sure all the joints in the body are moving the way they're supposed to. Joints are moved by muscles. My job is to make sure the muscles are doing their jobs and are balanced and are functional. And so we are functional doctors.
Yeah.
And the spinal cord runs through the spinal column, your backbone. So if your spinal cord column or your back is not functioning properly, it affects the way the nervous system communicates with your brain and to all the organs and muscles and cells of your body.
Yeah. Yeah.
It's amazing. It's amazing. And can you tell us what is ART? What does that mean? Not a lot of chiropractors don't practice ART. Tell us more about it.
ART is a subspecialty in the chiropractic profession. ART is patented. It stands for Active Release Techniques. It was developed almost 20 years ago by a brilliant chiropractor who practices that in Colorado, Michael Tighe. ART breaks down scar tissue or adhesions in muscles, nerves, and ligaments. There are only 24, give or take, chiropractors in Massachusetts who are certified in active release techniques. There are only about 7 that are fully certified and have nerve entrapment certification, and 3 of the 7 are in my office in Native. I'm telling you, the things that we got, in my 30 years of practice, I always had a lot of emphasis on the muscles as well as the spine, but I never could tell you with certainty what I was putting my hands on. Now with ART, I can tell my patient, and I know for certainty what my hands are on, which muscles are involved, and I know strategies to change function and lengthen. A lot of people are walking around with the emergency brake on. Until you release the adhesions in the muscle, you can exercise all day long. All day long, people come to my office and say, well, I have really tight hamstrings. And I evaluate them, and it's not the hamstring that's tight. The sciatic nerve is entrapped as it goes through the hamstring. Okay. So my job is to use these very specific tools, using my hands, or techniques to move and mobilize and free the nerve so it moves through the muscles the way it's supposed to.
Interesting.
You improve the function of the nerve, and you improve range of motion and mobility.
Huh. So for our listeners and viewers that are outside of Massachusetts, would every state have somebody has ART?
There are ART providers around the world, and the way to find an ART provider is you go in the activerelease.com website.
Okay.
Activerelease.com.
Okay.
There's a link that says Find a Provider. You put either your zip code or your name of your town, and it gives a list of all the certified providers and tells you how many courses they've taken. And if you have a foot problem, you want to make sure the doctor you see has at least lower extremity certification.
Oh, very
so
specific.
It's very specific, it seems like. Okay.
Huh.
Yeah, yeah.
Interesting. It's only been around for 20 years.
About 20 years, yes.
Huh, interesting. Okay.
How is it different from what most other chiropractors would be practicing? Because I've been seeing, I was in a car accident when I was 23, I guess, and so.
About 2 years ago.
2 years.
Yeah.
No, a little more than 2 years. Yeah. It's nice of you, Wendy.
Yeah.
But I was in a car accident a long time ago, and so I've been seeing chiropractors off and on ever since then. And depending on where I lived, it depended on what kind of methods they used, and they're different. And I've been seeing a chiropractor now for a while that I really like, and I'm just curious to know what you're practicing is different from what most other chiropractors would be using.
Well, I do manipulate or adjust patients, which is the art of getting joints moving, relieving subluxation or dysfunction in the body.
Okay.
And I would assume that most chiropractors, that's by definition, chiropractic means done by hand. And most chiropractors use their hands to adjust or mobilize, manipulate joints. This is kind of in my opinion, the icing on the cake. There are a lot of different ways to work on muscles, but I really have found this to be really revolutionary and really has changed my results, and the speed of my results and the type of results my patients get under my care. So I do, assuming it's appropriate, I do adjusting on every patient, and I also do some level of active release on most of my patients.
Okay.
Huh.
Yeah, and I know I was talking to an acupuncturist, and I was talking to her about active release therapy, and she said you can adjust, a chiropractor can adjust your subluxations and your bones as much as all they want, but if your muscles are glued together and you've got all that scar tissue kind of pulling it down, they can only do so much without actually adjusting the scar tissue and releasing that out, and that made a lot of sense to me too.
And that's what ART does. It really very accurately and very quickly breaks down that scar tissue.
Yeah, it's amazing. I mean, I've experienced it. It's really an incredible therapy, and it did wonders for my shoulder, my whole body, and that it was originating in my neck, and so you think, oh, it's my shoulder, but it's never that, right? It's a whole line of things,
right.
and
they're out of alignment. Yeah.
The whole concept of nerve entrapments, there's something called the brachial plexus. The brachial plexus is a bunch of nerves that come together that exit your neck, that go down through these muscles here, under your collarbone, under your armpit, and down your hands. And very commonly, especially if people spend time on computers and poor posture, the nerves get entrapped in this area here, and you need to release them. And these nerves go to the shoulder, they go to the elbow. We have patients that come in with tennis elbow, and even before I touch their elbows, I work on their nerve entrapments. I release the muscles here, and then they actually feel better before we even touch the elbow. Then, of course, we work on the elbow as well. It's almost like a toaster oven with a short and a fuse box. The spine is the fuse box. The injured tissue is has the short, and you got to address both parts.
Interesting.
Yeah. Even my son, my oldest, I remember when he went and he had his first adjustment, he was like, wow. It's an amazing release. You can feel the difference instantly.
When it's very nice to be young.
Yes.
Young people respond much quicker than older people, depending upon how chronic the condition is. But yeah, people get used to pain, they get used to restrictions, and all day long people say, I didn't realize how tight I was.
Yeah.
Dangerous driver all these years because I couldn't turn my head as far as I can now. I thought that was normal. So people get used to things, but that's not health.
Right.
So, going back to George Burns, when he turned 90, he said, if I knew I was going to live this long, I would have taken better care of myself. You got to work backwards. People take care of their teeth. They go to their eye doctor.
Yeah.
They take care of their cars. They get the wheels aligned, the oil change. But your body is mechanical. And my job as a chiropractor, the way I look at my job as a chiropractor, is to keep the function of the body the way it's supposed to be, optimized function, so that parts don't wear out, so they don't seize together. And when things don't move, especially joints, they wear out. And arthritis is caused by lack of motion over a long period of time.
Arthritis is caused by what?
Lack of motion.
Really?
Arthritis when we're talking about arthritis, there are two types of arthritis. There's the rheumatoid arthritis and the wear and tear osteoarthritis, the degenerative joint disease arthritis, which is the much more common.
Right.
I'm talking about the degenerative joint disease. I'm not talking about rheumatoid here. But joints need to move, and they don't move, they rust. And arthritis is rust. And I have studies that I could show. I can't go over the webcam, but we have studies in the office of people who've followed came with arthritis. So they follow recommendations for at least 5 years, take another x-ray, and the arthritis looks exactly the same. And then we have patients who say, well, I feel better, I guess I'm okay, see you later, and then they come back a few years later or 5+ years later and take another x-ray, the arthritis is always worse.
Yeah.
Mm-hmm. The key, you go to a dentist to prevent tooth decay. Mm-hmm. You spend to see a chiropractor to prevent spinal decay, which is arthritis. So once it's there, then we can maintain it, manage it so that it doesn't progress. But it takes a commitment on the part of the patient to get out of pain, to rehabilitate their spine, and to get regular oil and lubes or tune-up care to those joints.
Yeah. That makes sense.
Yeah.
One of the thing that we think about when we talk about our podcast here, Mighty Married Moms, is part of our mission is to create the life that you've always wanted. Mm-hmm. And when we're young, vibrant people, we don't say, I gotta prepare for when I'm hobbling around with a cane, or you don't think about that. You think about being vibrant and healthy, but that takes work and intention. And that's what we try to bring to our tribe, our listeners and viewers, is tactics on actually how to appropriate the life that you've always wanted. And so that's what we do. And so this is just so great because it's certainly bringing to my awareness something that I hadn't been really thinking about. And like you said, if you walk backwards from 90, how do you get there vibrant and healthy? And so this is great. So this is
care isn't the answer for everything, of course, but it's part of the toolbox that everyone should have. You should
absolutely
right. But you need to make sure that everything is aligned and functioning correctly.
Sure. It's just basic good preventive medicine, like getting your teeth cleaned or seeing your primary care physician once a year to make sure that all your internal organs are working properly, and getting your annual breast exams, and and men getting their annual prostate exams eventually, and so it's just basic preventive care that we should all be aware of, and I think this is important too, and that is. We should support our partners in making sure that they do the preventive care that they need, and we need to teach it to our children so that
and model it and do it and bring them like Linda's bringing her children to a chiropractor, and I don't know that they have big huge sports injuries, but you're saying no, this is a really good way of just holistic good care of the body that we've been given, and let's preserve it and make it work well and optimally as long as we can.
Yeah. Dr. Weiss, what are some of the conditions that you do treat when you see children who have who are struggling with different issues? I mean, there's preventive care that we're just talking about, but what are some of the issues that you see that kids have to deal with?
Well, we see a lot of kids that have sports injuries.
Yeah.
Mm-hmm.
We see a lot of kids who just come in, their mother said, my kid has bad posture. Help him stand up straight, and he doesn't. And I say, well, he doesn't know what that means. And part of it's an education process.
Uh-huh.
And if everything is frozen, pulling you forward, and you try to stand up straight, you're not going to get, you have to break all the holding elements. It's a guy wire system, and the muscles are pulling you forward. We see a lot of kids with scoliosis that are, typical. Once again, the medical approach is scoliosis. Yes, we have a curvature. Let's monitor it, and if it gets bad enough, then we'll put a brace on. If it gets really bad, then we'll have to maybe do surgery or. My job is, you got a curvature. Why do you have a curvature? Are you holding your book bag? Crap, that's way too heavy. And work to find out the functional causes of that curvature, the muscle imbalances, and adjust those kids. If someone comes in under the age of 12 and they're starting a curvature, chances are we could arrest or even reduce or eliminate that curvature. So
really?
A growth curve, the key is just to maintain it, keep it as functional as possible. And then, of course, we see kids all the time with just this awful slump posture. They spend hours in front of a computer. They have hours in front of, playing computer games. They come in with thumb problems and elbow problems and shoulder problems. And it's, and it's okay to play these games. And it's okay to use a computer. It's okay to use a smartphone. But you can use a smartphone like this, or you can use a smartphone like this.
And for our listeners, the first example was bending over, and the second example was sitting up straight, holding it at eye level.
At eye level, yeah.
Right. And your computer, and, I know my kids, they love to slump on the couch. That's their favorite
place to put the computer on your lap and, or the phone down on your lap and looking at it.
End up from 30 years from now, and they look just like that, all bent over.
Oh, yeah.
And then this is the risks of needing to go to assisted living as they age, and that's what we're trying to avoid. We want to be healthy. We know that healthcare continues to change. We're becoming more responsible for beside our own health, both economically as well as functionally. So better to work backwards. Make sure you have good posture. Make sure you're eating well. Make sure you're exercising regularly, getting the cardiovascular. Because the truth is, studies have shown over and over and again, you can play all these computer games, on TV, these mind puzzles and everything else, but nothing beats movement for keeping your brain healthy.
Yeah. And I know another thing, is chiropractic care is generally known. People accept it. Now insurance companies will pay for a certain amount of chiropractic care. But I know that I believe you were involved actively in it. A lot of chiropractors talk about the fight to prove it's a legitimate practice and to get the medical establishment to recognize chiropractic care as something that's really important.
That is very true. There's a lot of politics in healthcare. Before I moved to Massachusetts 12 years ago, I practiced in Vermont. I was the president of the Vermont Chiropractic Association when Governor Howard Dean, who was governor at the time, signed the bill into law saying that you could not discriminate between any licensed healthcare provider. And they actually signed that bill in my office in Williston, Vermont.
Oh, wow. Very good. Thank you. Good for you.
Yeah, that's very impressive.
Yeah. Wow. Let's hear a little bit about the other stuff. I understand that you've been called in to go assist some celebrities on occasion.
Yes, I've been very fortunate. I get to go backstage quite often. I've worked with everyone from the Wiggles to Justin Timberlake, Spice Girls, Kiss, Shauna Bowser from Sha Na Na.
That's great.
And many, many more. And it's really wonderful working with these world-class performers. And when I get a chance to work with them, I always ask, it was usually a one-shot deal. I get called backstage. I ask them, what do I need to know? And do have issues because, you don't just go on stage and play your guitar anymore. Now with their performances, and they give 6 or 7 shows a night, and they go from one major city to the next. It's very physically demanding. But the other half say, you know what, we tune our instruments before we go on stage. We need to tune our bodies as well so we can get the possible. And but it's really a pleasure. It's a lot of fun doing that.
How did you get that gig?
You know what? It all started with active release techniques. I got a phone call. A woman who was a broker for healthcare services called me up and said, at the time it was the Wiggles, they're playing this arena. We need a chiropractor. Are you available? And I said, yes, but who are you? And I said my name. And she says, I always look for ART certified chiropractors first, and you're the closest ART certified chiropractor to the arena. And I went, and as they say, the rest is history. She opened the door for me, and now it's been a lot of fun.
Oh,
that's
fascinating.
Great.
Okay.
Yeah.
So these people that are on tour and they're in different cities, they kind of line up healthcare providers before they get there?
Some tours do, yep.
Wow.
You got to understand something. When a major performer comes to town, it's just not that performer. They might have 200-300 support people behind them. It's the crew, it's the truck drivers, it's the electricians, it's the instrument handlers, it's the dancers, it's the costumes, as well as the stars. So, I work on the whole, the whole crew.
Yeah, and they're on the road a lot. I mean, that's their life. So that's how they have to do their care. They know that they need to.
That makes sense.
To do that for sure. Yeah.
I'm really appreciative.
Yes,
I'm sure.
Yeah,
I'm sure. I bet. And so, if you were to summarize, or if you were to kind of encapsulate a family approach to chiropractic, what would that look like? Like starting when your kids are like, suppose they have you don't assess that they have bad posture. Like, what would be an ideal, from your perspective, an ideal family approach to chiropractic care?
Well, I love working with families. The best approach, young kids usually have minimal issues. I'll see them once or twice a year. If they have a sports injury, or if they have a fall or a trauma, fall off out of the crib, or a long trip, we'll see them maybe a little bit more often. Get them back on shape. If some mother says been told their kid has colic or ear infections, they want to be treated with me in addition, and co-treat with their pediatrician. I'm happy to do that. Most of our adult patients find that coming in once a month, once every 6 weeks, once we get them healthy, is a great way to stay healthy, especially if they have arthritic changes, which a lot of my patients walk into. Arthritis is not a normal part of getting older. I have patients in their 20s with significant arthritis, and I've got patients in their 80s with almost no arthritis. It really is a wear and tear, of how we abuse or use our bodies.
Interesting.
Car accidents, falls, traumas, just like some cars are lemons, some bodies, have more challenges, more issues than others.
So really building it into your life and encouraging your family to build it into their lives, and it like you said, you can avoid some things that we think are normal, like getting decrepit or hunched over. That doesn't have to be part of the human experience.
Exactly. What's really nice is I developed really nice relationships with people, and I get to see them on a regular basis. So they'll tell me things, and issues before they become big issues. You might see their primary once a year for an annual. But I get the little things. If it's something I can manage, I, of course, manage it. If it's something that's more significant, I'll say, you know what, Nazzy, you got to go back to your primary. So we work together to make sure. And I work with, and I put things to bed, that things that will going to get worse if they're not addressed on a regular basis.
Absolutely.
That's great.
Well, we are unfortunately running out of time here, but I'm just going to say, because I've been going to chiropractors for most of my life too, and if you haven't tried a chiropractor that does ART, you should definitely do it, because I think it's the best care that I've ever gotten. And Dr. Weiss is really the top in his field, really, for ART therapies. It's really an amazing experience. It's an amazing therapy. I really love it. And so we just want to ask you in closing, how do people find you? Anything you want to tell us? Anything else you want to tell us before we sign off?
Any projects you're working on or things you're excited about?
Well, thank you for inviting me, first of all. Secondly, this has been great. We are in Natick, Massachusetts. The name of my practice is Performance Health Center, or performancehealthcenter.com. Our phone number is 508-655-9008. Three exceptional chiropractors in this office, myself, Dr. Vanetta Reinen, and Dr. Ball. We call her Dr. V. And,
she's great.
And we love working with people. If we're too far, if you call our office, we can try to find you someone closer. You can find the Active Release website. I love giving these presentations. I love giving talks to companies on ergonomics and how to sit correctly. And I love walking to schools about backpack safety and about spinal hygiene, things that you should have learned when you were in elementary school, and middle school, and high school. I love doing those type of presentations.
Absolutely.
Excellent. Excellent. Well, thank you so much. We really enjoyed talking with you. It's, just
learned a lot.
Great information. And we will be posting a link to you so people can find you on our Mighty Married Moms website. And we just want to ask our viewers, if you like our episode today, which I know that you did, please subscribe to our YouTube channel, Mighty Married Moms, and you can find out all the information you need to know from Dr. Weiss, our interview with him today, and others. So we're excited about our project, and we're really grateful that you were willing to interview with us today. Thank you so much.
And
so great.
Subscribe on iTunes, too. That's really, we ask our listeners to subscribe on iTunes. So,
Good.
Well,
thanks so much.
Thank you.
Take care, Dr. Weiss.
Thank you.
Thank you for joining us for this episode of Mighty Married Moms. Tune in twice a week on Mondays and Thursdays to meet fascinating and inspiring guests who will help you create the life you've always wanted.
You can find these episodes and special gifts just for you at mightymarriedmoms.com, as well as a link to our Facebook community,
where we continue the conversation around the kitchen table. Please also help share the love by leaving a review on iTunes. We'll see you next time.